We're going to continue with chapter 16, and we always seem to come back to this illustration as we discuss the assessment, treatment, and management of a patient with acute abdomen. It's very important for you to know what organs and blood vessels lie beneath the quadrants that you'll be examining. So just memorize this. Okay, the first thing you want to do is have your patient lay down in a position of comfort and have them bend their knees slightly to take any tension off their abdomen. Inspect the area for trauma and distension, bulging, or discoloration, and determine the presence or absence of pain in different areas. Any masses, if they're tensing, guarding, if there's any rigidity, and check the right and left flank areas individually. Be sure to document your findings and note the times on those as well. Ask if the pain is constant or intermittent, and ask about medical conditions. Find out if anything makes it worse, like coughing or motions, and if anything makes it better. Determine if there is nausea, vomiting, loss of appetite, a bloody stool, if there's fever or diarrhea. And palpate the 4 quadrants of the abdomen, and again remember to palpate the painful area last. Lastly, palpate just above the pubic bone in the midline where the bladder is located to see if there is a problem there. Of course, you're going to start palpating from the quadrant farthest from the side of the pain. So the patient has said that their pain is sort of toward the right lower quadrant of their body. So you're starting on the other side. The patient's in a position of comfort, and you're going to take vital signs frequently. Why is that? Because with acute abdomen, this could be a serious situation, and you are looking for trends to make sure the patient is not deteriorating. You're going to use supplemental oxygen if it's needed, or if you think it'll help your patient feel better. Don't give them anything by mouth, and why is that? Because they may end up in surgery, or you just want to simply avoid vomiting. They're going to transfer them to a higher level of care and encourage them to seek advanced medical care if they don't want an ambulance called for them. When we're managing a patient, just do an in-depth physical exam. Of course, you're starting with the ABCDs. You're going to have them in a position of comfort. You're going to take vital signs frequently. You're going to give them supplemental oxygen. Don't give them anything for mouth. Transfer them to a higher level of care. Encourage them to seek treatment. Okay, here we're back at our patient. As you examine the patient and listen to his story, you're concerned the patient may have a serious lower abdominal problem. You place the patient on oxygen, you keep him comfortable, and have him transported to the hospital. A week later, the patient's wife comes to the patrol room thanking you and the patrollers that took such great care of her husband. She reports that he had surgery for acute appendicitis and is doing well. Okay, recognize that those patients whose signs and symptoms suggest the presence of a potential acute abdomen, implement life-saving measures, and rapidly transport the patient to a definitive care facility. By having a fundamental understanding various abdominal and pelvic structures and knowing the basic causes of common GI and GU problems, you will be prepared to effectively manage most GI and GU's related disorders that you encounter. The abdomen and pelvis contain solid and hollow organs, major blood vessels, and nerves. And remember, the abdomen is divided into 4 quadrants. We've gone over that so many times. And patients with abdominal and pelvic pain may not present until their signs and symptoms are unbearable. Abdominal pain may be the first indication of a life-threatening emergency. Abdominal assessment includes an exam of all 4 quadrants. Of course, again, all patients with abdominal pain should be taken seriously and referred either to a physician or transported to a hospital. Do not give a patient complaining of abdominal pain anything by mouth. We go over these and over these because if you're in a scenario or you're working with an actual patient, you think, oh my gosh, what do I do? How do I assess them? How do I treat them? how do I manage them? That's why we go over the basics over and over and over, so you feel comfortable and you can give following medical care participants valid information that will help them in their assessments as well. It's interesting to note that a heart attack, or an AMI, acute myocardial infarction, can present with abdominal pain. Acute abdominal pain may be the symptom of delayed presentation of intra-abdominal trauma, such as a ruptured spleen or renal injury from the previous day's fall. We don't know. That's why we have to be thorough in our assessments. Okay, that's the end of our GI and GU Chapter 16 PowerPoint. Thank you.